Well, thanks. First off, thank you guys for coming out. I know if anything, it's a little bit of a little trip from Long Island, but I think that this topic is well worth it and well needed in the community. So if anything, I'll try to focus a little bit on when people say liver cancer, very commonly I'll speak to patients and they'll sit and say, my friend died of liver cancer, but it started in their it started in their colon. Now that's not what we're talking about today. Liver cancer right now is actually considered hepatocellular carcinoma, which means that it originated within the actual liver. When you have disease that goes from other sites of tumors or, whether pancreas or take this just so I can be a little bit comfortable again. Yeah. All right, cool. So when it comes from other organs or so, what ends up happening is that's considered metastatic disease. That's not what we're talking about today. We're talking about disease that is primarily mediated within the liver, starts in the liver. And so what we'll do is we'll talk about a couple of different neat risk factors that we need to be mindful of, especially in the community as far as surveillance, risk factors, and things that we can do to mitigate some of these risk factors. So this is a busy slide, but I think it does definitely demonstrate some of the reasons why it's needed within the urban community. So when you look at the overall incidence of hepatocellular carcinoma, and I'm going to use HCC just so that you guys, you don't hear all these big words or so. But the reality is, if you look at where these deep blue colors of the slide are within the states, you can see that in the Northeast between New York, New Jersey, Pennsylvania, there's a pretty significant population that we have from there with hepatocellular carcinoma. And a lot of that, my personal feeling, as well as the data supports that it's primarily mediated because sometimes we don't necessarily have the appropriate screening protocols within the community. So I think it's very important for us to kind of go through this. You can look in look at that big area in the middle Midwest or so. Now it's not really densely populated. There's not as many people there, but you still don't see the same degree of incidence of hepatocellular carcinoma. So California, some of the states where we have a lot of people that reside there also is a little bit of, I call it a big gap in socioeconomic status between education, background, funds, and education as well. So hopefully this gives you a little insight. So when you go back home and you do happen to hear one of your colleagues, friends, or so mention something about liver cancer, you'll resonate and go back. Maybe you should do X, Y, and Z. So if we go back and look all the way back to like 1975 or so, we've been seeing that there's been a general trend where there's been a steady increase in the development or actually diagnosis of hepatocellular carcinoma. And even up until now, the numbers have actually increased. This was back, it stopped the data, I believe, in 2020. And we also had patients at that time, obviously, with COVID. But when you look at it, back in 1975, my suspicion is that one, disease really wasn't caught in time and it wasn't really diagnosed. So I think that's a real underestimation. But when you also look at that, this also represents the overall survival once diagnosed with hepatocellular carcinoma. So we're talking about realistically, in the present day and age, a 5-year overall survival for patients that get diagnosed with liver cancer, not disease that came from somewhere and went to the liver. This is de novo or from the beginning liver cancer. You're looking at about 18% of patients or so will live. So that's about 1 in 5 patients when you get a diagnosis at the 5-year mark. So it also helps understand some of the prognostic or what would we expect as far as the overall disease course when diagnosed. So I went through a lot of the data, and this was actually from the cancer epidemiology biomarkers, and I went through to look to see what really makes a difference between when patients are diagnosed and why when people are diagnosed, what really accounts for some of the differences in the populations. And what you can kind of see is that generally just about every ethnicity, you see the same exact thing. So the black columns that you see are the dark colors, so for instance, non-Hispanic white, and then there's gray and there's a darker gray. The dark one is actually patients that have what we consider lower socioeconomic status. So patients that either at the highest level of education, maybe perhaps don't have as many funds. And like I said, Malik told you, I grew up in Brownsville and I lived in Left Rock for a long time. So from Queens and Brooklyn, a lot of my community growing up was exactly what we kind of see. And so when you look at this, you can see that patients that come from those backgrounds, they have a worse prognosis or a worse outcome just based on your socioeconomic status, and that's all throughout, whether black, whether white, whether Spanish or Asian American, or so you're going to see the same type of incidence. So it's important that for patients that in the community, we have ways to kind of make sure that we survey and we have resources for them within the community and your primary care docs. So the other thing that I wanted to show you guys is that not only does that end up influencing patients that get diagnosed, but you also see that within particular communities, depending upon where you are, education, academic level, finances, resources, and everything else, you can see that there's a distinction between how long patients will actually live from that. So it's very important that everything that I talk about today, between drinking, between alcohol, between all that stuff, if there's a way that we can kind of mitigate or decrease some of those things within the community, I think that there's a lot of upside as far as patients actually living longer, getting detected earlier, or if anything, screening and doing some things to mitigate their overall risk from developing hepatocellular carcinoma. So now the most common out of everything, any of you guys heard of hepatitis B? Hands up. All right, good. What about C? All right, good. What about A? Okay, I can just keep on going, A, B, C, D, and everybody's gonna raise their hands. So the reality is B and C, if you look at it, these are the largest or the highest incidence of actually progressing to hepatocellular carcinoma. Both of those can actually develop and cause patients to develop cirrhosis, and the act of actually developing cirrhosis is what causes the hepatocellular carcinoma to evolve. So from this slide, you can kind of see that, when you're normal, you don't get exposed to hepatitis and it doesn't kind of hang around or so, you don't get these scarring of the liver. Now, cirrhosis, any of you guys actually know what cirrhosis is? Oh, come on, give it to me. Somebody speak out. That's good. That's good. So the liver is responsible for breaking down the alcohol, but when you have cirrhosis, it's not necessarily the liver. There you go. Okay, so what happens is you can think of it as a scarring of the liver, right? The liver basically gets fibrosed or gets scarred. So think about when you cut yourself or whatever have you, the way that you heal is that you basically will scar in that site and you'll see it. So when you have toxic exposures, alcohol, things of that nature, and then we talk about hepatitis or so, the liver has to recover. And in doing so, after long periods of time of having to do that, you'll get scarring of the liver. And that is what cirrhosis is. And the act of actually having the liver scar over and become cirrhosis, that's the independent risk factor for why you can develop cirrhosis. Now, you also see something down here called fatty liver disease. Anybody heard of that? Come on, someone put hands up. We're gonna have some fun. You guys ate? Did you have? Okay, good. I know everybody heard of fatty liver disease. So generally, fatty liver disease is primarily from diet. And when you go to your doctors, I'll be somewhat mindful of that, but how many have heard of friends or colleagues that have been diagnosed with fatty liver disease? Okay, and what is like the first thing that, their doctors or what they tell people to do? Okay, good. That's exactly it. So we have to do diet modification. So, a little sneak was refrain from alcohol consumption. But a lot of times what I find is when I see patients and I have to counsel them, when someone says you have liver cancer, I'm not liver cancer, I'm sorry. When someone says that you have fatty liver, people usually don't take it to the same degree of, I have to do something. It's, diet and exercise. I keep on hearing that, diabetes, diet and exercise. And every other metabolic disease is diet and exercise. But this is very significant. For about 5% of patients that have fatty liver will progress through cirrhosis. And from that, you can have, from the cirrhosis, hepatocellular carcinoma. And that is very important for us to try to mitigate. So if we can do some simple things as far as changing diets, refraining from alcohol, or decreasing alcohol consumption, these are all some things that we can really do to help out. So, and pardon me, because a lot of these slides are going to be pretty, I guess, academic, and you see a lot of slides and graphs, but I'm going to try to make it as interactive as possible, so at least you walk away with something. So, any questions? Anybody have any questions? No? All right, awesome. Oh, you got one. Well, that's true. That's very true. So you look at some of the contents of what you consume, and like you mentioned, high fructose corn syrup. Generally, we try to recommend patients to be a little more green, a little more organic products or so, and that's where you end up having issues with. So I think it's a testament that you are what you eat. So try to eat a little cleaner, and then we'll kind of hopefully mitigate some of these risk factors. So this slide here, there's a lot of words, but I'm going to summarize it to make it a little bit easier. So when this was basically from an electronic medical record. So when you go to the doctor and the doctor's sitting there, how you feeling today? How you doing? right? And they look behind you or whatever have you. They used all the data that they went back for about 8 years. And in doing so, they were able to correlate basically what is the likelihood of, if you have a history of hepatitis B, hepatitis C, if you have a history of heavy binge drinking or diabetes, what's the overall incidence of you developing hepatocellular carcinoma? Now, when you look at these numbers, you're talking if you have hepatitis B or have had it, 49% of the patients. That's a lot for patients to develop hepatocellular carcinoma or liver cancer or HCC. And then if you have, heavy history of heavy binge drinking or alcohol use prior to diagnosis, you're talking about the same 40%. Same thing, basically, history of diabetes. Now, when you start thinking about all of these things that we have, we can definitely mitigate a lot of these, right? So a lot of these are pretty much, we can control what we put in our mouth, we can control what we do. Some things we don't have control over, but as far as alcohol consumption, we can do that. It's pretty easy. And if someone told you you can get cancer from drinking, do you think a lot of people would actually drink? You think so? I don't know. I've been in many rooms with patients, and if I told them, and what I would say is I think that those are all things that, if you're aware or cognizant of as far as having something that you can physically say, if I don't do this, I'm not going to have cancer. There's very little things in life from what I take care of where I can sit and say, you can do something on your own to decrease your risk of developing cancer. That doesn't include going to expensive doctors and doing things. It's just really being mindful of all of the things that you do day to day. So the other thing is hepatitis C, right? So we raised our hands. I think we had a fair number of people that basically said that they have known someone that has had it. But when you look at this graph, you can look at with time, Hep B, we generally don't see a lot of Hep B now. A lot of that is predominantly going to be in the Southeast Asian population. So communities that have a lot of Southeast Asian population. But hepatitis C, when you look at this, these are basically by years. So you end up seeing that from 2000 to 2001 to 2005 to 2006 and beyond. What do you see? What do you guys see as far as a trend? That's this guy here. It's increasing, right? So why do you think it's increasing? Well, hepatitis C. So hepatitis C, are you guys familiar with how patients get hepatitis C? So, all right, needles, right? So it's a bloodborne pathogen. So anytime that you're exposed in the sense of having needles and IV drug abuse, another common is sexual activity or so. These are all. Oh, good one, blood transfusion. So now in general, let me demystify the fact as far as blood transfusions giving you hepatitis C. When you go back probably about, I'd say 15, 20 years or so, the likelihood even now for you to get hepatitis C from blood transfusion, you're probably looking at about 1 in every close to million transfused blood products. So it's very, very unlikely that that would happen. Now, you go back early 90s, early 80s or so, it wasn't as prevalent for them to test for hepatitis C. So there have been some patients that have been correlated to have had hepatitis C through exposure from transfusions, but not now. Now you can have transfusions and the likelihood of getting it is close to 1 in a million. So I would not be concerned about you getting transfusions if you need one now. Not necessarily. I mean, so the thing is, hepatitis C is not something that is going to be this overwhelming, fulminant. You get sick and you feel bad, and it usually will evolve into a chronic, a chronic illness. So that's why you have many patients that we end up seeing that have had hepatitis C. But the nice thing about hepatitis C, what do you guys think? Is it curable or not curable? Oh, now it is, right? We got some really crazy meds and everything else that we can give patients and actually cure disease. Now, if we cure it, what happens to the risk of hepatocellular carcinoma or HCC, since you guys have a cool new word? Exactly, right? So it's very important for patients now, if there has been any, high risk, activities or so, or if you know that someone has had hepatitis C, you should see a liver doctor, you should see a GI doctor, because we can cure these patients. And curing patients from hepatitis C will decrease the incidence of hepatocellular carcinoma or liver cancer. And I think that's a win-win on many different fronts. So it makes me have to work less. milk thistle and all of those things. I wouldn't necessarily say that milk thistle and all of that is going to help in this context, but it's just something just to be mindful of. You can take depending on your other medical conditions. And I always recommend, because I've seen some pretty bad toxicity from patients that, just go to the local vitamin shop and they pick up a bunch of things because the 19-year-old behind the counter said it's good for your liver or whatever have you. So anytime that you guys go and get things, get medications from GNC and vitamin shop and everything else, it's natural. But some of these natural things are not meant to be taken on a daily basis. And you should really make sure you talk about that with your primary doctor or your doctor just to clear it based on other conditions and other medications that you're taking. All right, so I'm going to try to speed it up a little bit to make it so that you guys don't go to sleep. But if anything, this is the fourth world leading cause of death, hepatocellular carcinoma. So you're talking about, you think about breast cancer, lung cancer, but now we're talking about hepatocellular carcinoma, fourth leading cause of death worldwide. And if it's all about doing some of these modifiable risk factors, decreasing alcohol consumption, finding patients that are diagnosed with hepatitis C, trying to treat those patients, making sure as far as diabetes, you figure out better ways to kind of do diet modification. These are all things that we can decrease the incidence of people dying. How awesome is that? Pretty cool, right? It's pretty cool, right? I don't have to do anything. I don't have to give chemo. I don't have to give any. I can just tell you to eat better and everything else, and I don't have to worry about this. I can sit and maybe go on a vacation or something. So I think it's very important just to be mindful of that. So as I mentioned before, the 5-year overall survival rate is about 18%. So that's 1 in 5 patients that are diagnosed with it. So if you kind of go around, that's a lot, right? So if you have 5 friends that are diagnosed, if one of them are going to die from it within those 5 years, and people that live beyond that, it's very uncommon or rare, but we have been doing some pretty neat things, and I'll summarize it towards the end as far as the treatment, because we have a lot of cool things that we can do now. The difficulty with this diagnosis, if you don't see a doctor regularly, you're probably not going to get diagnosed with it. So you really need to make sure that you see someone so they can do blood work and look at your risk factors, because you're not going to have any symptoms of having hepatocellular carcinoma. This is going to be something that will theoretically sneak up on you without you really being aware. There aren't any regular blood tests in the sense of when you see your doctor and they do blood tests for your annual workup, you're going to sit and say, oh, well, my doctor did blood work. How come you didn't find the liver cancer? And this happens to me all the time when patients come to clinic. I was seeing my doctor, they did all of these things, but you have to be open and transparent as far as your risk factors from that standpoint. And then your docs can send off tests that are appropriate. If anything, this is the same type of summary incidence of cases as far as patients that have hepatocellular carcinoma, which is worldwide or so. And I just wanted to focus on a little things because I'm really big into healthcare disparities and making sure that within the community, and it's really disheartening to see how medicine can be practiced in very different ways depending upon where you live. The biggest or the largest determinant of how patients will live or how patients will do in general is going to be your zip code. And that makes no sense in the US. From that standpoint, we have way too many tools, way too many ways to access, medicine. Now we do telehealth. So there's no real reason that patients should not have care from that standpoint. But if you go back and look, they're talking about here, about 75% of patients or so in less developed countries will basically have risk factors of developing or dying from HCC. I kind of look at some of the communities that, I grew up in or so, Janet and all of these other people, because we always refer to people as Miss First Name, and that's just a community thing or so. And you find out that they probably did not have to die if that was the case. They probably could have been screened appropriately if they were going to doctors. And I know people don't like going to doctors. No one likes to come and hang out with me. But I think it's the right thing to do, because if we can keep patients around for longer, they can be productive, they can do things, and you can enjoy your family and everything else. So as I mentioned, you have about 830,000 people in the world back in 2020 that died from hepatocellular carcinoma. I'm going to speed it up a little bit because we got some really big words up here, and some of this stuff is relevant, but I just want to make it so that you guys understand. This one, I wanted to focus on this one over here. There's a condition known as hereditary hemochromatosis. Have any of you guys heard of that? No. Okay, so hereditary hemochromatosis, that means that hereditary means that it comes from the family. Okay. And hemochromatosis implies that you have too much iron that hangs around in the liver. And so some patients that have gene mutations that tell them to hold on to too much liver, will be at higher risk of developing cirrhosis, and those patients can develop hepatocellular carcinoma. And because we're detecting it more and more, because we can do these genetic tests, we find that incidence is also something to be mindful of as well. From here, this is about the fatty liver. Same type of logic in the sense that you see that there's been an overall increase if you look with time. Now, this is because people are indeed going to doctors a little bit more, but also because we can kind of see that there's been a relative increase in detection. And so when people say that you have fatty liver, what are we going to do? Change the diet, right? Stop drinking and drink less alcohol. That's right. All right. And then what I'm going to do, just because of time's sake, this is a summary of some of the other risk factors that we kind of went through. We talked about the liver cancers, fatty liver, and then we also talked about some of the alcohol consumption that can also cause it as well. Yes, less sugar. That's right, because of diabetes. We talked a little bit about that as well. I'm sorry? Male sex, because we find generally it's a higher incidence in males versus females. That's all that implies. Okay, it's not saying that males are doing anything. Get it out of the gutter. All right. So, all right. So what we'll basically hepatocellular carcinoma. As far as diagnosis, this is one of the diseases that you actually don't. In some cases, need a biopsy. You can get blood tests as well as imaging studies, whether a CAT scan or MRI, and that's sufficient to really get the diagnosis. And as far as staging, there's a couple of paradigms as far as one, how we risk stratify patients, and it has to do with how well their liver is once you develop cirrhosis. All of these things, whether bilirubin, albumin, these are protein levels, all of these get affected when the livers no longer work anymore. And you can think about it, A is the earliest stage, C is the most advanced. Patients that have C disease are going to be a little bit more difficult to treat from that standpoint. Now, when I mentioned before, this is really busy. There's a lot of stuff up there, right? You're like, what does this mean? What are we going to do? Or whatever have you. Now, the reason that I think it's important to have this slide up there is that a lot of times when you hear about liver cancer or hepatocellular carcinoma, if it's early, it's small, we can do local things. We can cut it out. In some cases, depending on how healthy the liver is, you can even consider doing transplant. Other patients, we can do what's called local regional embolizations, where we take some chemotherapy, put it in the vessel, close off the blood supply to the actual tumor, and the tumor dies, which is great. And we do MRIs after that for surveillance. But for patients that get more advanced disease, so such that we have seen disease in the liver, they develop disease that from the liver either goes somewhere else or are not really amenable to having some of these local approaches, surgery, cutting it out, or going in and blocking off or causing some of the tumors to die within the belly. Now, when you look at all of this, there's lots of names. And if Malik had a tough time with the hepatocellular, please don't try this one. But what I would say is this is just here to demonstrate that just because you get diagnosed with cancer, and I see this day to day, once someone says that you have cancer, a lot of people lose hope and they sit and say, well, you know, if that's the case, I'm not going to do anything. The treatment is worse than the disease. I'm just going to kind of ride it. This is purely just to demonstrate that there's a lot of active research going on. There's a lot of therapies here that allow patients to live longer, have improved quality of life so that they can enjoy the days. Even though we have disease, unfortunate that patients develop, it should never be something that just because you get diagnosed with a cancer that we're not hopeful in the sense that we can treat you. And it's important to be mindful of your quality of life and also allow patients to have treatment so that they can live a little bit longer and enjoy their family members or so. And I find it's kind of frustrating because one of the one of the hospitals that I work from chief at, it's a very underserved community. And when patients get diagnosed, my discussion with them is very different than some of the other offices that I have because they have this sense of hopelessness. And cancer care now in the US, I don't think that anyone should ever feel that way. There's lots that we can do with lots of different diseases. There's treatment up there known as immunotherapy, which is really, really cool. And we use the immune system to fight cancer, the cancer cells. And we also have some diseases that are really targeted based on your disease that really improve the responses and allow patients to have good quality. So I'm going to leave you guys with a lot of this. So the one thing that I want you guys to remember is to not try to drink from that standpoint. Be mindful of your exposure. And also, if you guys do go to see your doctors pretty regularly, it's a good idea to make sure that you have had hepatitis C testing, or at least just to make sure. And if there's any questions, you let me know. There's one more slide. It's the same thing. It kind of recaps all of the treatment changes or so. that we've had with time. And so these are all just to demonstrate. And we got one more. And this one here is basically for us to make sure that you guys have resources and know that if there's any questions, you can always ask your doctor. And from this, there's a againstlivercancer.com. You can go there. It's a very well laid out website for you guys to understand the overall clinical significance of such. And if there's any other questions, you guys let me know. All right.